Our next speaker, Regina Imburgia.
Good morning, Mayor Rawlings. I'm Regina Imburgia from the 14th District, and I'm here to talk again about fluoride. I know I'm very persistent because persistence sometimes pays off, and I've met a doctor, and his name is Dr. William Osmondson. And I asked him, because he's a dentist. He's a dentist, and he also has a master's in public health. And he also has an MK, and an MK means he was a missionary kid. And this dentist, for 25 years, believed in the fluoridation and fluoride being good for your teeth. He wrote prescriptions for it. He had no idea that what we're bringing forward was even out there. I mean, even if he did, he probably would have looked the other way like most people do, because you assume it has to be good because the CDC said in their statement years ago that it is one of the top 10 health achievements of the 20th century. But after 4 years of people kind of bringing things to his attention, he finally took the time to look into it. And now, for the last 5 years, he's been a very big advocate for exposing the dangers of fluoridation. So I bring to you guys, another time that I'm bringing to you, I want to say to you that there has to be a reason that the health minister in Israel on August 26th has decided to ban fluoridation for 7 million people in her country. There has to be a reason that in Canada, where 2/3 of the communities used to fluoridate, it's now half of that. I mean, communities all over. Plus, as it is, America started out in the 50s, not knowing about fluoridation, and of course the people at that time used the research they had and the data that they thought they were looking at, but then they didn't go forward with researching more. There was a decline. I know several people even here have mentioned that their parents had worse cavities than they do, and it's anecdotal like that, but there was a decline and decay across the world because people were learning about hygiene and better food. In Scotland, they have a Child Smiles program that's very, very effective. And it's just, in the poverty areas, we still have the decay, even though the big cities, Dallas fluoridates, and all the other big cities do too. And that's where the cavities are, is in the poverty areas. It really is a nutrition, education, and hygiene issue. And the fluoridation is an issue that needs to be looked at as systemically, or whatever the word's called, in your body. When the CDC made that statement, it wasn't the whole CDC. It was the oral division of only 30 people that said that statement. They didn't look into the body and how when it's ingested. So, please, I'm going to keep coming, and several other people are, and I want you to have that little thing in your mind. Think about it. How could the health minister of Israel, 7 million people, why are these people thinking that it's not a good idea? It's not tinfoil hat. It's not crazy. Thank you very much. I hope you'll have another committee meeting on it and look into it and have a debate. Thank you very much.